So hello everyone, welcome to my YouTube channel. So today we'll be talking about tendinitis, tendinosis and tendinopathy. We'll try to rule out the differentiation between these three topics because most of you all have confusion regarding these topics, okay? So we'll be talking about tendinitis first. Itis, that means inflammation. There will be acute inflammations on those tendon whenever you're referring to tendinitis. So when you're referring to tendinosis, SIS in the end, that means this is a chronic degenerative changes of the tendon. It may last from your 2 months to 3 months phase, okay? In these cases, there won't be inflammations. In tendinitis, there will be inflammations. In tendinosis, there won't be inflammation. But it will be a chronic degenerative changes of the tendon in this, okay? And it is a chronic. First one is acute. That means recently it has occurred. This has taken time for your 2 to 3 months to build up. Next is your tendinopathy. Tendinopathy is a non-specific pain condition. You won't know why you're having this kind of pain on your tendon. So this non-specific. It can be caused due to any causes. So tendinitis means acute inflammation. Tendinosis means chronic degenerative changes of the tendon. Tendinopathy, you won't know why you're having the pain. Okay, so these are the three differences. And what are the features? So the features of these conditions are, whenever there's a tendinitis, there will be a swelling, inflammation, and there will be a warmth in your tissue. And whenever you touch over the tendon, there will be a crepitus. That means you'll hear a little bit of sound. Okay, so next features in tendinosis is that there will be a thickened tendon and there will be a pain during any activities. Okay, and plus there will be a morning stiffness. Morning stiffness referred to here whenever you're waking up. Okay, if you're having an Achilles tendon or tendinosis, in those you will have usually morning stiffness whenever you wake up from your bed. So in what happens in tendinitis, there is an inflammation, swelling and crepitus. In tendinosis, there is a thickened tendon. Because this is a chronic case, the tendons rub and wear and tear will be there, so there will be more adhesion formation, so the tendon usually gets thickened up. Okay, and there will be a morning stiffness. And next feature is your tendinopathy. In tendinopathy, what you will commonly see is pain with low tenderness, stiffness after rest. So whenever you're loading some kind of, suppose I'm trying to do a bicep curl, so I'm putting a weight here, and whenever I'm loading, there will be a pain. Okay, so next there will be a tenderness. Even whenever you touch these areas, you will feel tenderness. Okay, and stiffness after rest. After doing my bicep curl, I went back home and I'll start to feel stiffness in my elbow joint. Suppose if I'm having a bicipital tendon. PT management for this condition. First is going to be your tendinitis. So whenever there is a tendinitis, acute inflammatory, you will take a rest, but there won't be a complete rest like your bed rest. Okay, and you'll take little bit of ice pack and your NSAIDs, inflammatory drugs to the inflammations. But there has to be movements in your joints. There should not be complete rest of those joints or the tendon. You have to load those tendon regardless of pain. If there's severe pain, stop it for now, but you have to gradually increase in moving joint gently, and slowly will progress to the eccentric exercises. Okay, that's how you'll progress in tendinitis. So the PT management for tendinosis. In tendinosis, there has to be a load in controlled manner because it's a chronic case. In acute case, we'll take some rest, then we'll go to do the gentle mobility exercises and eccentric exercises. In these cases, what happens in tendinosis, it's a chronic case. Regardless of anything, you have to load those tendon for the recovery. You have to teach the muscles, tendon and bone to take the load. Then you can slowly progress from 5 kg load for 15-second isometric hold. Again, you can go for 7 kg load for 15-second isometric hold. In slow manner, you can progress. Then after that, you can add your MFR, fascia release, or any blocking exercises, or you can do your resistance training exercises, whatever you know, myofascial release, you can work on it to release the soft tissue around it. Okay, don't worry about the inflammations. In these cases, in chronic cases, there won't be usually inflammation. There will be a tenderness and pain during movements. So learn to load those tendon, okay, in tendinosis. So the PT management for tendinopathy. In these cases, what you have to do is there should be a slow reduction of load plus isometric hold. Suppose I'm doing for the patellar tendinopathy, okay, I'll do a knee extension with 15 kg load in the starting with a 15-second hold. Then the second set is going to be 10-second hold with 10 kg load. Again, I'll go for 7 kg weight for 15-second hold. But we'll decrease from 10 kg, 7 kg in 5 kg. I'm just giving you because squat usually take more loads. You can take 40 kgs, 30 kgs depending on the patient's condition and their strength. But you'll do a progressive decentric load on these cases, okay? And the next you'll do a HSR, heavy slow resistant training for them, slowly gradually increasing to the eccentric exercises. Then after that we'll focus on the loading, suppose plyometrics. From slowly we can do a slow plyometrics, then to the high plyometrics and little bit agility training, then back to sports for tendinopathy. So tendinitis, tendinosis and tendinopathy, so these are the PT management. So next we're gonna do the individual tendon exercises. I'll be posting on the next video for that, okay?